or if you're going to use a nasal aspirator or this Frida sucker, I would recommend having some sort of saline on hand. So whether that is a saline like this, I personally use the Beekeeper Natural saline solution, just squirt that up there and then suction right after. Or they do make little saline drop packets that you can drop in there that are one use as well. And the other thing would just be something for pain or fever management. This can be anywhere from the cold sock, wool sock method, or the garlic sock method, any of that to help with fever management. And obviously there is Tylenol or Motrin. Motrin is also ibuprofen. I always have those on hand, but they are not my go-to, as I am a little bit more conservative on using those. And if I do use those, I use this brand that is dye-free and has great ingredients. So I would highly recommend looking into this if that is something you want to switch over to. And then I will use some more oral remedies too. So I love the Earthly Feel Better Faster. I pretty much go through a bottle of this every couple months because it's so good for so many things. Then the other thing along the lines of fever stuff is just having something to make sure that you can give the medication with. So whether that is just a simple syringe, there's multiple ways that you can get kids to take medication, and I can give a whole separate video on that. If anyone is interested, just comment below and let me know. And then types of syringes you can get a simple syringe like this. You can get syringes for little babies that have a pacifier adapter to help them take it, kind of tricks them into it, where you can pull up your medicine and then give them the pacifier and squirt it. My first child loves taking medicine. He'll ask for it. My second child, who's 1, hates it. So it really just depends. Every kid is different. Just knowing your kids and knowing what tools you're gonna need for them. And then the last thing that I would recommend having on hand as well is some sort of thermometer. Personally, as a nurse practitioner and knowing what is most accurate, I would have just a traditional simple thermometer. This one is Mom Cozy, and it's just it's the easiest and most reliable. The forehead ones, the ear scanning ones, they work, but I tend to see that kids come in with higher reports of fevers than what they actually are. If you just take a simple thermometer, if they are under 1, a rectal temperature is the most accurate, and I know that can be uncomfortable, but taking it rectally, and then if they're older than that, if they'll take it by mouth, putting this under their tongue, or if they won't take it under the tongue, the middle of the line would just be under their armpit. So honestly, these are so cheap, the cheapest method, they're gonna be the most accurate. So this is the other thing that I would recommend having on hand. Final thing is some sort of humidifier to run in their room. And again, if you can't have that,